Your pain problem started with an injury. When you get injured, you either go to the doctor or ER, and you get usually x-ray done to make sure you did not fracture anything or dislocate anything. And when that looks good, your doctor will prescribe some pain medicines and you go home and get some rest. Sometimes your pain starts without any specific injuries. It just comes on its own. And most of the time, doctors will check, don't even order an x-ray or anything. You give you some pain medicines, you go home and lay low for a few days. 3 to 4 weeks pass by, your pain gets worse than better. You come back and see the doctor again. Some doctors will send you to physical therapy at that point, and some doctor will go ahead and order an MRI, and some don't. You start getting worried about pain because it's getting intense and spreading in the larger areas, and it starts affecting your sleep and daily activities. Eventually, MRI will get ordered. And I'm not against getting MRI done. If I'm in your shoes, I want the same. If my pain is getting worse and I tried medications, rest, physical therapy, and no improvement, I will be worried and I want to know what is going on. Now, the problem is the results of the MRI and how it affects you. So this is what I would like you to talk, this is what I want to talk about today. Hi, I am Dipti Patel, physical therapist with 20 plus years of experience, therapeutic pain specialist and a yoga teacher. Don't forget to subscribe and click the bell so you get notified when my new video is released. I have so much information that I can't wait to share with you so you embark on your pain-free journey and live fearless, active life. MRI is done for anything and every part of the body nowadays, but for today's discussions, I'm keeping the chronic pain in mind. I will only talk about spine, that includes the neck and back, and shoulders and the knees. Now, after an MRI is done, usually the nurse will call and share the MRI results with you. Most of the time, they will read as a radiologist has returned, and sometimes you get the report in the mail. 80% of the verbiage on those reports does not make any sense to the people who are not in the medical field, right? So what do? You Google it or ask your doctor to simplify it if they're willing to answer. Now, I don't know why, but every radiologist writes down every single wear and tear of the body of the joints in the report. And you will interpret completely different. For example, for the lower back, if it says, whatever the results it says, it's going to come out to be my L5S1 has the most degenerative changes, my vertebra has slipped on top of each other, and I have some kind of a disease. That's only things make sense to you, right? Now, in your mind, you're going to go, oh my gosh, I got some kind of a disease. Here is the thing. Many times I will evaluate my patients and I would suspect something is going on the L3 on the right side. When MRI results comes in, L3 on the right is clean, but significant wear and tear on the L5 on the left side. Go figure. I hope this doesn't offend some of you, but I will be honest and say it anyway, because I care for you. Some people will get the CD of their MRI results, and what they do, they take pictures from the CD or online records and ask friends or a Facebook group, hey, what do you think? What is going on in my back? I see the concern, but my doctor said no big deal. Stop doing that, please, because you are hurting yourself. Stop Googling your diagnosis and taking advice from the person who has never treated one person in their life. I'm sorry if I offended you, but here are the things I want you to know. 96% of the people without back pain can show signs like disc degenerations and the disc bulges. And do you know it starts as early as age 20? I do want to share the story of my patient. A 43-year-old female came to see me for back pain, and I asked her, hey, what brings you in today? And she goes, did you read my records? I have a disc bulge in my back. And I said, yes, I have read your records. And I ask, hey, do you mind if you tell me when was your MRI done? And she goes, about 2 years ago. And I ask, what time of the day was it done? Was it in the morning, afternoon, or evening? And she says it was in the morning. I said, okay. Were you laying down or standing? And she says, laying down. All right, here is the thing. Do you know discs are 20% fuller in the morning compared to at the end of the day? Have you heard that you're shorter at the end of the day than you first wake up in the morning? Because of the gravity and compressive forces, the disc is height by overall half an inch of the spine at the end of the day. And when you lay on your back, when the discs are fuller in the morning, so the gravity pushes the nucleus pulposus, which is a jello, down towards the spinal cord, and it looks like it's pressing on the spinal cord the way the picture looks. One more thing I asked her, were you laying still or you moving around while the MRI was done? Well, she says, come on, I was laying still. And yes, most of the time you have to lay still in order to get the MRI done. So it takes the pictures when you are not in motions. But you have a pain when you're moving around, right? You have pain when you bend over, when you walk, when you stand, when you sit for a long period of time. It usually doesn't hurt that bad when you're laying still. So does the MRI shows what happens to the joints when they are moving, joint fluid movement, the blood flow to the area, the nerve receptions, the muscles dynamics, the pumping of the muscles, the gliding of the nerves, what's exactly turning on, what's exactly turning off? No. I want to share this very important data. So if you're multitasking, come back to me. Disc bulge do reabsorb. Let me share a story. There was a woman who came to ER with excruciating back pain. It was going down to her leg and she couldn't move. So they did a CT scan on her and it showed she had a huge disc bulge pressing on the nerve. So they asked her to come back every week to get a CT scan done so they can keep an eye on the disc bulge. Do you know by the 6 weeks, the disc bulge went down by 50% and completely gone by 9 months. Now, this was a very profound study. So there were 12 more studies came out after this particular one and they found the same thing. So if you had done an MRI about 1 or 2 years ago and hasn't done after that, your disc bulge might be gone. So disc bulge do heal over a course of time. Remember that. So they go down by 50% in 2 months and 100% in 9 months. I didn't even know about this for first 15 years of my physical therapy practice. They don't teach this in the PT school or even in some of the medical schools. My point is, look at a bigger picture. There is way more things that's causing your pain other than just the disc bulge. Let's look at the shoulder next. Rotator cuff tear is a huge concern with MRI and a small labral tears at times. Do you know 60% of people over the age of 30 have some kinds of rotator cuff tear but no pain? We have 4 rotator cuff muscles and 7 big other movers muscles which are like deltoid, lats, pectoralis, biceps, teres major, rhomboids and middle traps, which plays the role of the moving your shoulders. So if 1 or 2 muscles are torn and you still have this 9 or 10 other muscles to function, you'll be just fine. Spillman had a beautiful study he did. He took 16 people and had rotator cuff repair done surgically. Then they went through a 16 weeks of rehab. They had a CT scan done at the end of 16 weeks and they found full function and no pain. Do you know, they did CT scan on them again and they found 4 of them had a torn rotator cuff muscles and they didn't even know about it. Now let's talk about the knee next. The main problem in the knee is arthritis, or called bone on bone, meniscus tear or ACL tear. But there are 40 to 60% people who have a knee pain, has no knee pain, shows the same MRI results. 1/3 of the basketball players have some kind of a joint abnormality or a knee arthritis. Not only that, the football players, the soccer players, and many other sports players have ACL tear and meniscus tears are very common. In the last 5 years, it's becoming more and more common that they don't go through the surgery because the rehab time is 16 to 20 weeks. That means from surgery to back to the sports, it takes them 6 months. Now, athletes who don't want to go to the surgery, they are able to play at some capacity, and when you see the results of the athletes goes through the surgery and the athletes doesn't go through the surgeries, the same results. But they don't have to go through all this pain. Now, when the other thing is sometimes MRI doesn't show anything and you're still in pain. So that implies that pain is all in your head. But no, pain is not all in your head. Your pain is 110% legit, even though the MRI doesn't show it. Because the MRI doesn't show everything, but we know that there are many other possible pain generators that MRI cannot show, including joint stiffness, joint instability, muscle tension, strength, flexibility, circulation around the area, postural habits, movement pattern, how tissue respond to the movement, nerve activity and mobility, nerve electrical activity levels, the type and the distributions of that, the brain activity. So if your MRI is normal, remember MRI only shows the structural issues. If your MRI shows age-related changes like a disc degeneration or a disc herniation, stenosis and arthritis as well, we call them wrinkles on the insides, do not, I repeat, do not worry about it. Now pay attention, this is very important. You only need to worry about the MRI if it shows this 5 following things: fracture, dislocation, cancer, infections, or the combinations of the symptoms. It could be a loss of bladder or bowel, movement, foot drop, you cannot walk more than 100 feet, you start losing a grip on the objects, your fine motor skills like buttoning a shirt or cutting something or threading a needle. Other than that, don't worry too much about your MRI results, because fear adds a fuel in the pain fire, big time. It does not help you. Your symptoms are most likely due to nociplastic pain. That is from actual physical changes in the pain pathways of the nerve, spinal cord, and brain. And they will not show up in any kind of a scans. In our program, we do this 360-degree assessment. It's like a bird's eye view assessment of the entire person, looking at everything, like not only the mobility, but also a lot of other drills that tells us what kind of pain they have. Actually, 23 physical therapists in our department, and none of them do this kind of testings. So there is not much awareness out there for nociplastic pain. So if you're interested in finding the root cause of the pain, I have the link in the description below called Finding My Root Cause of My Pain Guide. And there is a quiz along with some other questions, and you'll find out what kind of a pain you have, and that will guide you with what kind of actions you want to take to tackle the kind of the pain you have. So please check this out. And if you love this video, this information was helpful, do not forget to click the like button and tell me if you have any concerns, any questions. Would love to help you, and thank you for watching.